Hey everybody, this is Dr. Tim Dunn, and I'm here at Advocate Integrative Medicine in Johnson City with my main guy, Cliff Andrews.
Hello.
And we're going to be talking today about low back issues. How many patients suffer from sciatica? Yeah, we get that a lot, right?
Yep.
Here's the problem, folks. 80% of back surgeries are considered failed. And that means, Cliff, that if you go in with a pain level of 8 out of 10 and you have surgery, if you walk out and your pain level is 8 or higher, it's failed. So what that's telling you, even if you walk out and it's a 7, now it's a success.
Oh, that doesn't sound successful to me.
No, it doesn't. So one of the things that we do really well here, folks, is we differentiate the problem, right? And there's 3 areas that it could be the problem. So when you look at low back pain, one could be the disc. And this is the disc space here, between the vertebrae. Fair enough, folks? It could be the disc. 2, it could be the muscle. And this red is the muscle, and that's the piriformis muscle. That could be entrapping the nerve. Or 3, it could be biomechanical, meaning the bones are misaligned. And I'll tell you this, for you to have a disc, you got to have biomechanical. For you to have a muscle, a large majority of the time, 70%, you got to have biomechanical. And the reason muscle is because you could go to the gym and do something crazy.
Right.
Right? Or you can have a car wreck and just blow all this stuff up. So what do we do different? Exactly. So when patients come in, we're going to do standing functional x-rays. Right? Now they're weight bearing.
Right.
Now patients are like, okay, this is how I hurt.
Right.
Okay, that's when I want the films. I want to put you in a position that you hurt, and because that tells me exactly what the tissue is.
The whole story.
Exactly. We have, on the other side of the room, we've got this decompression table. If I put you on a decompression table and the pain gets better, I have a disc. If I put you on the decompression table and it gets worse, I have biomechanical.
Wow.
So the treatment itself can help me differentiate what the problem is. And if it likes to switch around, meaning go sciatica on my right leg, sciatica on my left leg, now I know it's muscle. Now I know it's a piriformis syndrome that's grabbing on that side. So this is how we do it better, folks. We combine all the disciplines. We combine the medical and the chiropractic and the PT to evaluate what your low back is doing to know if the driver of your pain is a disc, a muscle, a biomechanical, or a combination. And the reason that I phrase it that way, folks, is because if you have low back pain, we can do an MRI, and it may show degenerative joint disease, decreased disc height, arthritis. And we think, oh, there it is.
Right.
You got pain down the left leg, and I've got a disc bulge hanging out here at L5. There's our problem. But this is why 80% of spine surgeries are failed, because we're using that type of diagnostic. What we need to be doing is a functional diagnostic, and that's what we do here, Cliff.
I love that. That's so, you don't see that level of care basically really anywhere else, where you're combining all of these things and saying, no, I want a whole picture. I don't want just a part of it. I want the entire story of these people.
Yes, and that increases the rates of success.
Nice. Yeah.
You know, we've had probably 3 or 4 patients that come in today, and this is a Wednesday. We had 3 or 4 come in today with low back issues. And we've had them on the decompression table, and we've done physical medicine and stretching of the piriformis and the QLs, and then facilitate muscles like glute med and all the rest of those guys. We've done all that assessment to figure out what is it that's driving that patient's pain. That doesn't mean we don't need to fix all of these things, and we will.
Right.
But first, we got to figure out who's the culprit.
Exactly. Yeah.
Who is it? That's how we have our success. And that's what makes us different, folks. That's what makes us different. So when you come into our office, we're doing functional diagnostics. Then we're putting you through a battery of tests that will determine exactly what it is your pain generator.
I love that. I love that. You know you're going to get taken care of when you walk through those doors. You just know it.
We got you, folks.
Yeah.
So if you've got low back pain, if you've got sciatica, if you've got things down your legs and cramping and everything from your waist down, we're your center for it. Advocate Integrative Medicine, otherwise known as AIM, because we aim to get you better, we aim to get you healthy, and we aim to do it faster than anybody else, and we aim to do it at a less cost and give you your life back. How much is that worth? That's what it's about.
Absolutely.
So folks, click below, give us some shouts, give us some likes and some loves and all the rest of that. Go to our website, go to our YouTube channel. Cliff's gonna put all that stuff in there. Give us a call. Give us an opportunity to show you what we can do for you that very few people can. Folks, have a great night. It's Dr. Tim Dunn. We're with Advocate Integrative Medicine out of Johnson City, Tennessee.